This episode of Straight Outta Health IT is brought to you by Welling, your trusted partner connecting healthcare organizations, data, and innovation for a healthier community. Welling helps healthcare providers navigate complex challenges, from analytics and AI to workforce solutions and community health impact. Because at Welling, we believe when healthcare is connected, everyone thrives. Learn more at wellinkcommunity.com.
Straight Outta Health IT, the mic stays surgical. Christopher Cunny moves vertical, purposeful. Strategist with the vision, breaking every system's cage. Guests unfiltered, flipping chapters every page. Industry talk raw, no sugar, no varnish. From policies to tech, the convo ain't tarnished. Blueprints unfold, the future in the dialogue. Cutting through the static sharp like a monologue. Change makers in the building.
Welcome back, everyone. I am Christopher Cunny. I am your host of the Straight Outta Health IT podcast. I am so excited to have on the show today an amazing individual that's going to talk about designing healthcare systems where clinicians can actually thrive. I call her the clinical unicorn. We are going to have this unfiltered dialogue, and we're going to explore a lot of different concepts and topics related to this technology. Before we get started, let me just kind of give you a little bit of rundown of this individual today. Angie Cox. Angie is someone that, again, I call the clinical unicorn. And trust me, when you hear about her background, you'll understand why. She's a nurse, she's a social worker, she's a healthcare administrator, a clinical system strategist, and founder of Nautilus Solutions. She is a leading clinical strategist for smart hospital programs at Etroba. And she also chairs the HIMSS Professional Development Committee and translates clinical realities into actionable strategies that actually work in the real world. So welcome, Angie, to Straight Outta Health IT.
Thank you so much, Christopher. I am honored to be here. I've been a fan of yours for quite some time.
Oh, thank you so much. I've been a fan of yours as well, too. The feeling is definitely mutual. Before we get started, and I always ask my guests to do this, is tell us about you. Tell us about your journey, your background. It's absolutely fascinating. I know it already, so I want my tribe, my listeners, to hear it as well. Your background in nursing and social work and health administration, and now you've got more 3 and 4 letters behind your name than the alphabet soup, which I applaud you for all those accolades and accomplishments you've achieved. But seriously, walk us through how you became what, it's affectionately termed a clinical unicorn, and what led you down this multidisciplinary path.
Well, I was going to focus on the short version, but I think I have to start.
You got to start from the beginning.
Growing up in a small rural community, faith was very instilled in me at an early age. I knew from the age of 6 I was going to be in healthcare.
Wow.
On my desk
Great.
actually sits a picture of me being a doctor to my doll Brenda. So
Exactly.
I was also a sick little kid. So I
Right.
spent a lot of time going in and out of hospitals and doctors' offices before I was diagnosed with a hole in my heart. So
Oh, my goodness.
and I knew that, there was a reason for all of this. And so I truly felt called and led to healthcare. And all the way through school, I was going to be a pediatric cardiologist. I was so incredibly excited. And I
Right.
went to college and realized that chemistry didn't like me any more than it liked me in high school. So being a plan B person, my parents had instilled in me too, that, we always need a backup. And
Absolutely.
my plan B was social work and psychology. I was a great little peer counselor in high school.
Exactly.
Loved doing that. I was kind of the person everyone came to tell their problems to, and kind of help them work through some tough situations, whether it was suicide intervention or teen pregnancy and things of that nature that, I would often go, sounds like we need it, to travel to the counselor's office. How do you feel about that?
Right.
I was doing that already in high school. So I was like, it was kind of a natural fit for me. And my mom was like, that must be your calling. So I'm not going to back that. And I was like, I really wish you had backed that more, Mom. Because
I love it.
I was in Georgia. I was a CPS investigator,
Yes.
loved it, realized I needed a master's. And I took this opportunity to travel. I made it to Texas. My dad had worked out here at an early age.
Right.
And I heard all his beautiful stories growing up about
Yes, everything's bigger in
working on
Texas.
the oil wells. And I
That's
thought
right.
everybody wore cowboy hats.
That's right. Yes,
Or
everything's
it was like
bigger
the show
in
Dallas when I was little. Nothing like that, by the way. But at any rate, I came here. I went to graduate school,
Right.
and right out of graduate school, I was already dating someone, and that was very near and dear to my heart. And he became my husband. So I
Sure.
stayed in Texas, needless to say, and right out of graduate school, became an emergency room social worker,
Right.
where I really got to see that healthcare was messed up, and I needed a lot of work to fix. And so I did what I did in high school and lots of informational interview and spoke with a CNO. I think you'll remember this story as well, that I wanted to find out as much how to become a nurse and what
Yes.
it's like and everything and just how to be the best nurse possible, because I wanted to be
Right.
just like her. She wore these big, beautiful outfits, and she
Mhm.
spoke so articulately, and her executive presence was out of this world. And
Exactly.
when she found that out, she's like, "Oh dear, honey, you'll never be like me." And I was like, "Oh, excuse me." She's like,
Okay, reality
"You're
check.
a social worker, and you
Right.
stay in that lane because social workers simply don't have, the understanding or knowledge, and math and science is really difficult for you guys.
Sure. Oh,
So
wow.
you really need to kind of stay in that." And in the back of my mind, I'm like, "So you're saying I'm not smart enough?" I was like,
Right.
"No, Christopher, I had a 4.2 GPA in high school once
Exactly.
upon a time, and and it was
Sure.
in advanced courses. I was on the math team in high school.
Right,
Most
right.
people would tell you I was a smart kid and
That's right.
smart
So
kid.
she threw down the gauntlet and challenged
She had no idea. Exactly. And that just made me want to do it even more.
fire.
And I
Okay.
did it. I worked full time, and I made it through all of my nursing prerequisites, was accepted to nursing school.
Mhm.
There were 100 candidates, 400 applied, 100 were accepted. I was one of
Right.
them. Very fortunate, and just a blessed journey all the way through nursing school, because to date, out of my 5 degrees, it's the hardest degree I've ever
Oh, I
had to
can imagine.
undertake.
Absolutely. And
Um,
one of the toughest jobs on the planet, for sure.
for real, but
Yeah.
there's just so much that nurses do and bring to the entire healthcare
Yes.
ecosystem that is needed, and so many different ways that you can take that and travel with
Mhm.
that. And what I did after nursing school was become a mother baby nurse
Right.
at Baylor, a teaching hospital. And
Mhm.
that's where I really wanted my hands-on experience with the human interaction. And I kind of became the nursing champion on the floor. A lot of times I
Right.
was pulled into those situations where we need a research lead, or we need a
Sure.
safety lead, or we need a technology lead.
Mhm.
And I was all of those once upon a time. But I had some dear friends who kind of pulled me aside and said, "The whole reason you went to nursing school was the sexual assault world, and we don't see you
Mhm.
doing any of that." And I had to be true to myself and realize, let's take a step back. Maybe I
Right.
do need to do that. And I became a sexual assault nurse. So
Oh,
that was
wow.
my emergency room experience, and covered
Yeah,
about
there's a
11
story there.
hospitals in the Metroplex.
Yes.
And then I also, while doing that, I was a case manager, and my wonderful, intelligent boss pretty much took me aside one day and said, "You need to be an administrator."
Mhm.
At that time, I was at Parkland, and he
Right.
said, "Parkland hires MSNs. You need to go back and get your master's of science in nursing."
Mhm.
He said, "That's what you need to do." He said, "You're
Right.
wicked smart. You can do this." And I was
Sure.
like, well, I always wanted to do this, but I didn't. It just, they are those downloads and messages that you
Right.
get from the
Of
universe,
course.
God
Yeah.
in general,
In life
were
in general,
truly
so
leading
much
my
going on.
life.
Right. Exactly.
Exactly. And so I went back to school for a dual master's in science of healthcare administration, a
Mhm.
master's of science in nursing.
Okay.
And so, yes, 5 total health degrees in all.
Wow.
And after that, fell in love with patient safety,
Exactly.
and finally got to a level I was like, finally, I can make a big, important difference to healthcare.
Yes.
I had worked my way up, from the bottom, and worked my way all the
Mhm.
way up to patient safety, clinical risk management. Finally,
Mhm.
I can make the difference that I wanted. And unfortunately, I wasn't in that position very long before I realized my ethics and theirs were two different things.
Mhm.
And my ethics strongly, aligned with God and my servanthood and what I was
Right.
meant to do here on earth.
Absolutely.
And yeah, I've heard little messages along the way, and I finally had my done moment when
Mhm.
someone had kind of whispered in my ears, "It's sometimes easier to keep your head down and carry on."
Oh,
And I was
interesting.
like, Yeah, no,
I wasn't built that way. Yes.
so I did. I left
know
the
that feeling.
healthcare hospital, and that was the hardest thing I think I've ever done in my life,
Yes.
Christopher, was do
Right.
that. And all of my faith went to Jesus. It really did. I had
Absolutely.
some very frank conversations with God, and one night
Absolutely.
he
Yeah.
kind
I've had a
of
few
gave me
myself.
right. And
Yeah.
the download kind of came to me that truly you can change healthcare from the outside in. You don't have to be on the inside to do it.
That's right.
And I remember that happening when I was laying there struggling in bed, just
Mhm.
trying to go to sleep. And so I sat straight up and I said, thank you. I needed that.
That's
And I
right.
laid back down and I fell asleep. I had the best
Mhm.
night's sleep in 3 months.
That's
Woke up
right.
the next day, learned how to start this networking, building a network.
Right.
And what are they doing on the outside of healthcare? I never knew that. Because when
Mhm.
you're on the inside, they don't really want you to focus on the outside. They want to focus on
No, they don't.
what's going on inside.
That's right.
And nowhere else either. Don't talk to other
Yeah.
nurses in other hospitals. You'll
Right.
just lead you astray. So
Mhm.
at any rate, I had some great networking colleagues who turned me on to consulting.
Mhm.
And then I had an amazing NYU professor that I got to network with. And he said, Venn diagram it. He said, you really
Sure.
need to niche down so I can help you. And so
Right.
my 3 circles were what am I passionate about?
Mhm.
And what am I really good at? And then where's the market going in
Right.
healthcare today? And
Absolutely.
those intersected with technology just beautifully.
Yes.
And technology is something I kind of loved writing and dealing with when I was younger. Even in the rural community, I think we had literally the first computer in the entire town. I was
Right.
also the champion
Sounds a
who
lot like my
everybody
family
else
as well,
in
too.
elementary school about the computer.
Yes.
So I was that girl. We couldn't
Mhm.
afford the programs at the time, so my mother handed me like an inch thick book for adults and said, you can read this, but you can learn how to make these programs and games and make it.
Right. Exactly.
She said that to like a second and third grade. She's like, you're smart. You'll figure it out.
Absolutely. Absolutely.
But I loved it. Met these beautiful
I was
people.
going to say, you were
at-
up to the challenge, right? Mhm.
Yes.
Yes.
At HIMSS, everybody said, you've got to go to HIMSS. HIMSS does exactly what you're trying to do, putting healthcare
Right.
and technology together. And so I went to HIMSS and met this beautiful group of people, sat with these consultants that from this organization I never heard of. I was like, Introba. And I was like, if you're not Deloitte Cognizant Vizier Premier, those were my targets back then. I was like, I don't know you. And
Exactly. You're not one of the big 5.
there again, just being led by a divine inspiration. And definitely God has been with me through my entire journey. And
Absolutely.
before the principal left the table, someone had said, hey, Mike, she's a nurse. You want to meet her?
Mhm.
And I stood up and met him. He said, would you be interested in being a clinical SME? And I was like, well, it's kind of what I'm doing now. And conversations later, contracts later. Now I work part-time there, and they are help. Intro, but you probably never heard of it either, have you? Are you familiar?
I have through you.
For everybody who doesn't know,
Right.
exceptional organization, but what they do is they focus on the build structure, building those smart hospitals that are
Right.
loaded with technology, that intuitive technology for not only patients, but the clinicians using it, and really focus on the right size of technology for everybody
Right.
involved. So oftentimes technology is shiny and exciting and everybody wants to spend lots of money on it, but
Yes.
they don't have lots of money to spend. So
That's
how do we
right.
get there and make it happen? So finding that right size technology for everyone has been key.
Mhm.
And that's kind of their sweet spot. They do the advising, we look at workflows, the integration pieces, help them with vendor selection and things of that nature. So I'm just really impressed with these guys. And I'm so
That's great.
grateful that I was led to them.
That's wonderful. That's what an amazing story, an amazing journey. I applaud you for defying the odds, challenging those individuals who had a very myopic perception about your capabilities and using that as your fuel to take you to places that, you may or may not have gone through had they not inspired you in some way. And I think there's an old saying, let your haters be your motivators. And so clearly that's something that you did. And, you followed your inspirational guide, your spiritual background to help support you and guide you through that journey. So again, congratulations on all that success. I did want to kind of talk about some things that you brought up, because one of those biggest challenges we face in health IT is really that disconnect between people that are building the technology and then the people who actually have to use it at the bedside, which kind of brings me to my first topic in bridging the gap between the clinicians and the technology. I mean, we've all seen it, Angie. Hospitals spend millions of dollars on new technologies like electronic health record systems and clinical solutions, and they roll it out. 6 months later, you're finding that clinicians are doing workarounds in the technology because it doesn't seem to work their workflow. Help us understand from your perspective, being a clinician, being someone that's now had to lead technology transformation efforts, what's going on? Why is that process broken? And what are some of the things we need to be thinking about doing to address some of these systemic issues that occur when clinicians and technology collide?
One of the first things that I have seen time and time again are really not the intention. We go in with really good intentions and honesty, but the system fails, just as you said. And one of the things I see quite often is the assumptions being made on both sides,
Right.
quite honestly, and from everybody. Everybody comes in with their own assumptions and their own bias, whether we realize it or not. And it's the person who actually steps back for a minute, takes a beat, takes a breath, and actually realizes their own bias and becomes aware of that intrinsic bias that they've got going on, or that assumption.
Sure.
And the biggest example I usually give is the administrator who has been away from the bedside for 10 or more years.
Right.
And oftentimes they're the ones called in to make these big, important decisions at the next technology that we're going to use and that we're going to need and what's going to fit into their workflow.
Right.
But oftentimes, how often have they actually had the conversation with the end user?
That's right.
The actual person using that technology, right? Have you taken them for a Diet Coke or a cup of coffee
Sure.
and said, hey, tell me about your workday? Have you
Exactly.
even went to the floor and stood at the nurse's station and just kind
Right.
of looked at where the nurses go?
That's
and how
right.
they
And where the
grab-
pain points are, where the actual pain points are.
Exactly.
No
And the stress
process.
on their
Mhm.
face. Are you
Mhm.
reading those? And even their breathing patterns. I mean, if you're a
Right.
clinician, you know all about respiratory rate and things of that
Sure.
nature and vital signs. So you can see things that the average person probably doesn't know to even look at. But you have been so far removed from actually looking at that for such a long
Right.
time that you forget
That's right.
that's really important. One of my favorite CEOs of a hospital was like Joel Allison, I believe.
Mhm.
And he bought me a Diet Coke one day as a nurse. And I was like, wow, he's a CEO and he's buying me a Diet Coke. I was really kind of impressed at him.
Yes.
But he looked at me. He was buying his luncheon right in front of me. And he looked down at my Diet Coke and he says, that all you're getting? And I said, so I have time for, sir, today.
Right.
And it really, really was. And he said, I'll get your Diet Coke.
Right.
It takes everybody.
Absolutely.
You go on. And he even told the cashiers, like, I got her Diet Coke. Forget it.
Exactly.
But how many conversations do we have with the actual end user? And
That's
I think
right.
it's up to us to remind them that how important that is and to do it early and often. Do it
Absolutely.
as early as you possibly can. Because,
That's right.
in design and development, or developmental design, we start with the skeleton on the outside, right? And the bones, and we look at each floor and each department and
Sure.
where all the networks and the data and all those intricate systems are going to go. But are we talking to everybody that's going to be in there using that data and those networks? That's
Yes.
where my passion lies. I love getting in there and saying, okay, you're right. They do need more space. Is it possible that someone has already designated that space for something else? Because as a nurse, I can tell you, we hoard things all the time. I used to
Absolutely.
hoard things for my favorite clinicians all the
Right.
time. That's how I kept my doctors happy.
Exactly.
Right?
That's right.
They knew
You
they
find
could go away.
workarounds. That's right. Yeah. You find workarounds that make your jobs easier and much more efficient. And that really reminds me of something that I talk about all the time. And that is, it's hard to digitally transform something you really don't understand, right? And if you don't really understand someone with clinical experience in the room, if you don't have someone with clinical experience in the room, asking those questions and probing them and getting their insights, you're basically flying blind. And it's almost impossible for you to build a better mousetrap for them if they're not providing that input. And I know with your organization, you're leading clinical strategies around smart hospital programs. What does really smart, you talked about it just a little bit, you touched on it a little bit, but I want you to maybe drill down into a little bit more. And that is a smart hospital design, right? Actually, what does it mean to put the workforce in the center of that whole process?
So when you're designing the hospital, developmental design, looking at the skeleton, on the inside, when you go deep inside the hospital, there's actually this beautiful design network of how things tie together
Right.
and the people utilizing that technology. We don't tend to see that until closer to the end of a project. And these are projects that go on probably 3 to 5 years at least.
I was going to say years.
It's not up to
Exactly.
7. Right. So you may not see that until closer to the end of the project. But a smart hospital design really is just that. You got your smartwatch
Sure.
and you've got your smartphone these days,
Right.
and you got everything is smart. But
Mhm.
that intuitive nature of a building that is structured to actually help with better engagement
Mhm.
and not just reach better scores in all honesty, but really help with patient safety, have
Mhm.
the appropriate triggers, help reduce alarm fatigue and things of that
Right.
nature.
So give me an example. Give me an example of a design, an innovation in design that your organization has recommended, implemented today that you didn't see, say, I'm just going to assume 20 years ago. You're probably 12 then, but
Thank
20
you.
years ago. Yeah, of course, of course. When you were a kid, you're walking through the hospital.
Out in the fields in the country with
That's right. Absolutely.
a chicken farm, actually. But yeah.
Yeah, tell me a little bit about, and just give for our listeners an example of something, when you talk about that smart design, what has, again, give me an example of a design technology or something you've implemented now that you didn't see 20 years ago.
Okay. So, and I know you have a wide variety of audiences, so
Right.
and listeners. So
Mhm.
I'm going to keep this probably a little bit more simple than I probably should. But let me know. You know the whiteboard, average whiteboard in
Absolutely.
your patient room,
Yeah,
right?
absolutely.
It has your nurse's name, maybe your
That's right.
doctor's name,
Mhm.
maybe your tech's name, your next
Mhm.
medication, things of that
Exactly.
nature, right? Now they're digitalizing that
Hmm.
where it becomes more of a touch screen
Hmm.
and it shows
Smart
exactly what
boards.
I need
Hmm.
for it to go on.
That's
And
right.
a lot of hospitals have now capitalized on the distraction concept.
Mm.
So they know
Oh,
how
interesting.
important entertainment and concierge services are to some of their long-term patients, like your cancer
Right.
patients that are unfortunately going to be there for probably a couple of weeks. They may need to
Exactly.
see a massage therapist. They may need to get their hair done and or their nails done, things like that. Those concierge, and they are truly concierge. But when you've got cancer and you may have 6 months to live, those are little things that keep you going.
Of course.
So those become very vitally a part of your life and a part of your family's life.
Absolutely.
And those just outlining some of that information on what would be normally your whiteboard that you would write down. Oh, you have a scheduled massage therapist appointment at 1.
Hmm.
That comes up digitally on your digital screen. It's a television screen essentially
Yeah,
in the patient's room that is nothing but the whiteboard.
absolutely.
Or it can dual as both. We
Mhm.
sometimes have the TV right beside it, and the
Right.
TV can do several different things. It can even do PSA announcement, public service
Hmm.
announcements, or
Sure.
it can do other
Patient education.
announcements. Your next scheduled appointment
That's
is
right.
at this time. Your discharge planning,
Hmm.
things of that nature. That's definitely things that we didn't see 20 years ago. I
Right.
remember being at the bedside and just creating videos, discharge
Mhm.
videos, and slipping in a discharge video
Right.
to help me through my
Right.
discharge teaching.
That's
And
right.
now you have a whole screen that will do that for you.
Absolutely. And just think about the impact on the clinician's workflow now, to your point. Now I don't have to go in, push in another, video tape of a recording of a patient education. I don't have to go in and do some of this administrative work about maybe ordering a massage, going in and updating the whiteboard if something changes. All of that can now be done digitally. I can't speak to that digitally.
just means you've spoken a lot. It's okay.
Exactly. And not to mention, those technologies, to your point, now have cameras installed in them. So now we can do patient monitoring. Patients can actually have video consults with their clinicians. And in some cases, patients can even have, a video chat or video call with loved ones and folks that they miss that can't maybe get to the hospital to visit.
Virtual nursing done through that too.
That's right. Virtual nursing. So there's a lot of advancements that have been made that have turned that whiteboard into really a smart board that allows the clinician to do their job much more efficiently, the patient to be able to leverage it as a tool to help them navigate their journey as well too, and then allow clinicians to now see more patients than they might have been able to see through the virtual nursing types of platforms and telemedicine platforms that didn't exist again, 20 something years ago.
I'm sorry to interrupt. Spend quality time with their patients.
Absolutely.
That's the ultimate goal
That's right.
And at least one of my ultimate goals is giving the clinician back time with their patient.
Yes.
Because they really and truly, at least 99% of them got into it to help and make a difference. Were called to it,
Right.
like I was, really wanted to make that impactful, meaningful difference. And unfortunately, there's so much in healthcare these days that they're bogged down with, whether it's documentation,
Yes.
or pajama time.
Right.
Documentation becomes pajama time. But at any rate, there's so many different things and inundated with meetings and calls and things of that nature that your average physician who sees at least 20 patients a day, maybe 30, is having time just to spend quality time with their actual patient. My personal physician used to pull out his cell phone and show me pictures of his Alaska trip.
Exactly.
You don't.
That means a lot to, a patient having that interaction with the clinician and making them feel more human again, right?
Exactly. And that they're not just a number. And
that's right.
Healthcare is scary enough without taking the human factor out of it.
Exactly.
So we will always have the human factor in healthcare.
Yes, let's hope so.
Especially with me in it. I'll make sure we do. But
that's right.
Yeah, no, truly. I mean, it's about the human nature of things. And that's the great thing about technology is it brings that back and gives that time back, not just for your physician, your other clinicians, such as your nurse and your techs and things of that nature that can actually carry on a conversation.
Yes.
That used to be my favorite thing my patients would always tell me is you actually stop and talk to us.
That's right.
I really appreciate that. Now, little did they know my 12-hour day was a 14-hour day because that I was okay with it because of that. My job.
Some of that, to your point, some of that administrative burden has been taken off of you. You have now the time to have that additional interaction with that patient. And I think it's a two-way street. You would probably, as a clinician, enjoy being able to have those conversations with patients versus now I got to move on to the next thing because I don't have enough time because the tools and technologies are limiting my ability to do that or lack thereof. One of the things that, and I unfortunately have had, fortunately or unfortunately, depending on how you want to look at it, have been a patient myself. I've been in a hospital for an extended period of time. And, one of the things that was always a little frustrating for me is, you go to the hospital actually thinking you're going to get rest. And, you don't a lot of times as a patient. There's people constantly coming in. There's sounds going over the PA. There's folks coming in and out of your room, checking your vitals, and there's always this activity. So you're not feeling great. And then you're not able to truly, in some cases, at least my experience, I wasn't able to truly rest. But let's talk to me a little bit about this concept around quiet hospitals, right? This concept of sensory overload, clinician overload, and how that impacts the patient and maybe even the clinician themselves. Talk to me a little bit about, from a smart hospital perspective, what are you guys doing to support the concept of more quiet hospitals?
And another word that we use a lot is alert fatigue.
Yes.
And that has become more and more popular the last 5 to 10 years is that we're finding, because you yourself mentioned how clinicians sometimes create these workarounds. So typically with technology, if it's not working and if the end user was never asked about that technology, I see one of three things happening. I see them trying to make it work, realizing it doesn't work in their workflow, and then complaining about it.
Right.
And then the person they complain to thinks, oh, you're just getting used to it. It's just early resistance. You're going to be fine. We spent millions of dollars on this. You can do it. So then you start creating a workaround. And those workarounds can be really, really serious and detrimental to not only the clinician, but the patient.
Right.
And the fact that one of the best examples I can have of a workaround is where those alarms are constantly sounding. And if the parameters aren't set just right, and if there aren't the appropriate steps and backups and the appropriate people were never asked about them, oftentimes, it's constantly sounding.
Yes.
And to someone who's not in the medical field, that sounds great.
Right.
But like yourself, you were a patient. You didn't get any rest because you kept hearing noise constantly throughout the hospital. And so
in my mind, people not necessarily reacting to it either. Right. It's like,
exactly.
Will someone turn that alarm off? Right.
And that's the third thing that they do. They tried to create a workaround so it would work. We tried to set different parameters and things like all of these bells and whistles that are going off constantly, but it's not working. So then the third thing that they do is just ignore it.
Right.
And like you said, like call lights at a nurse's station going off constantly and ringing constantly. And they don't know what to do. So eventually they kind of become numb to the sound. And I remember when I was a mother baby nurse, the nursery nurses, have you ever been to a nursery where all the babies are screaming all at once? There's like 30 babies in that nursery and they're all screaming at once, right? And the nursery nurses are not running around trying to keep every baby quiet. They get used to the noise.
Right.
And they get so used to it that you finally get used to the baby that's not screaming, because we get more concerned about the baby that's not screaming because that baby is choking.
Exactly.
And can't breathe and turning blood. So those are the babies that we're running to.
Right.
Not the babies making all the noise. And it's a very similar result to hearing all those alarms going off constantly. We're not listening to them. We're listening to the one, trying to listen to the one struggling, but we miss that. And the one noise that we actually heard that was legit can be detrimental. I mean,
absolutely.
Humongous lawsuit, not to mention loss of life, and another clinician who has just kind of turned their back on healthcare altogether because they're like, yeah, I can't do this. This is not what I got into.
So I'm curious, what are some of those strategies then as you go in your organization, you in particular go into an organization and you're seeing this alert fatigue that's happening, these alarms going off and no one really reacting to them anymore. What's your approach to addressing that?
Really taking a deep dive into their actual workflow and what they do pay attention to, what they don't. Just like your nursery nurse, they know to listen for the noise that's not going on, right? That baby that stops automatically crying because that baby's choking. We know there's something deep inside of us that our instinct has told us time and time again. So we listen to that. And having those really deep and meaningful conversations and the instinct that their particular staff actually have is vitally important. And
absolutely.
And it's important for all sides and all possibilities. I mentioned earlier that, I wish more administrators would take their nurse out for a Diet Coke or a cup of coffee.
Cup of coffee,
Yeah, just to get to know them and find out how their life really works and find out that they woke up at 4:00, got the kids dressed and lunches packed and everything so they could leave the home by 5:00 so they could get to work by 6:00 so they could get report on time by 6:30. And then they go for 12 hours and how that 12 hours actually looks, because I don't even want you to just look at the basic 12 hours. I really want you to look at the person that is working for you. That's what they go through before they even get to your facility. And see them as a human being, because that's who they are. In actuality, we ask them to be superhuman all the time. And they are for a large majority of time.
They've got a life outside of those four walls too that they're managing that directly impacts what they do on a day-to-day basis.
100%.
Yeah, that's good feedback. So, you work a lot with health tech innovators through your firm, Nautilus Solutions. I'm just curious, what are some of the biggest mistakes that you see vendors make when they're trying to develop products in the healthcare space?
There again is assumptions, right?
Right.
I think most people most people who get into anything healthcare have the biggest hearts ever. And I even sit on a board of people that they send to me that want to get into healthcare. And because they know I'm very truthful and very honest, and I have no problem speaking truth to power. But I think it's vitally important as part of my reason for being here. But oftentimes they neglect the possibility of speaking with the end user, actually looking at the actual facility that they're trying to market to. Here's their target. They assume that every hospital functions the same. They assume within that hospital are doctors and nurses and that they all function the same.
Yes.
They don't. Not even close. And without that education and the knowledge to have those conversations, I think they often build products that fall flat when we actually get to implementation. Because there again, we create a workaround or we don't use it at all.
That's right.
There goes your future referrals and future business down the road.
Exactly. Or in some cases, your technology never gets off the ground because it crashes and burns at that pilot site because you haven't taken those things into consideration. I'd probably add another one as well too, and that is thinking about equity. And what I mean by equity, building solutions that really only work for well-sourced, academic healthcare facilities with a lot of dollars and resources, and not thinking about those safety net hospitals and those other institutions, rural healthcare organizations that may not have access to all the infrastructure that some of the larger, more resourced facilities have, but yet you're trying to sell this solution to them as well. And you're not realizing that they may not be as successful in the implementation of it or getting the ROI from it because they don't have all the additional, resources, people, staff, infrastructure.
The right size, right? The right technology for the right size, for the right product. Because they often neglect that rural healthcare, within rural healthcare, you've got one individual that functions in like 3 roles.
Yeah, they wear 5 different hats. Exactly. That's right.
They got, not to mention 1,000 different tasks, but 5 different roles going on at the same time.
That's right. That's right.
Each day is a different one. But forgetting that aspect, we put ourselves in boxes in healthcare. Have you noticed that we tend to put lots of boxes and boxes? It's almost like those little dolls that open up. You have the smaller doll inside it.
Yes.
I can't remember. The name escapes me right now.
Those Russian dolls. I can't remember it exactly.
Yes.
Russian days.
And that's what we do in healthcare. And we seem to think that it's going to fit, but it doesn't. Because we neglected to see that their resources simply aren't there. And you can't just build for the big fancy and glamorous. If you're really,
you got to think about that.
Look at that.
Exactly. The entire ecosystem. And do you have technology that scales up or that tiers up based on the complexity of the organization?
Future expansion.
That's correct. That's correct. Absolutely. I would be remiss if, the title of, of this podcast is Straight Outta Health IT. And I would be remiss if we didn't talk about the topic everybody's talking about now, right? And that's artificial intelligence, AI. Give us your take on how AI is impacting your business and how you guys are applying AI to create better, smarter hospitals.
AI is something I have watched from the beginning because I knew it would be big, kind of like my mother watched computers. She knew that they would just be big, right? So I'm excited in the fact that I think we're finding more affordable ways to deliver AI.
Right.
And I think that was one of the biggest concerns for a lot of administrators is they were excited for the opportunity to help our clinicians do their jobs more efficiently and effectively and increase patient safety at the same time. But they also wanted that ability to pay for it. Technology budgets tend to fall at the very end because we just assume it's going to happen. One of those assumptions again, there we go. But at any rate, waiting to the end, we've learned time and time again doesn't help. So getting ahead of the game really helps. I love to see that other institutions are really looking at other hospitals and organizations and collaborating, and not really collaborating as much as learning what are they doing? How are you using this? And how is it not costing you $1 million? And how can we make it more efficient and useful in training? So one thing I always educate people about, and I'm sure you're familiar with this as well, is that nurses don't necessarily hate technology. It's the training, the lack of training that they have in it.
Right. That's
that
right.
kind of scares them and intimidates them to just a certain degree. Now,
Exactly.
most of your nurses and physicians are not intimidated that easily at all.
Right.
But when it comes to technology, they're not going to tell you that. But yeah, that's the one thing that
Mhm.
really kind of scares them to a certain degree is that lack of knowledge and understanding and education and training.
Right.
And
And
I
how
think
that lack
it's
of
right.
knowledge, that's right. And how that lack of knowledge may have a direct impact on that patient's life, right? If I don't know
Exactly.
how to use it appropriately, properly, is it going to put that patient in greater danger than if I don't use it at all?
And AI is only as good as the data going in it.
That's
You have
correct.
to remember that and never forget
Absolutely.
it. It
Yes,
does not replace a human. It doesn't replace you
that's
holding a
right.
hand, agreeing
Absolutely.
with your patient. It's
Yeah.
not going to replace a lot of things. And it's not going to even replace your very presence in the room.
Mhm.
So there's so much that it doesn't replace, but I don't see a lot of people concerned about that because they automatically know that if they're a clinician. So I think the world outside at large is more concerned about that than we are because
Yeah.
we're like,
Yeah.
no, it's not going to keep me from
Yeah,
any of that.
well, and I think, and I struggled with this early in my career in healthcare, but I think it's really apropos now in that healthcare is not always quick to adopt the latest and greatest shiny object either. They're okay with letting, other industries work out the kinks and the issues associated with it before they will bring it into their own, environment. And I was again, early in my career, frustrated with that because I saw this innovation that was happening in other spaces and we weren't adopting it. But as I became more ingrained in healthcare and understanding that we're talking about people's lives, it's important that those technologies get vetted in other places first and then slowly start to adopt them in this ecosystem because, again, it could have a direct impact on patient safety and patient lives in general. And it can have a direct impact on the clinician themselves. Does it increase more cognitive workload issues and make it more stressful and challenging for me to do my job? Or does it make it better for me and help me be a better clinician by the use of it as well too? And so I'm definitely a lot less bullish about immediately throwing technology at, an issue in healthcare before we've done our due diligence and we make sure that it has some true viability in this space as well.
And making sure that return on investment, the hard and soft ROI
Yeah,
really comes back.
that's right.
And I had a physician once because I remember LASIK surgery was all the rage, especially here in Dallas, Fort
Yes.
Worth. And I asked one of my ER physicians, I was like, are you ready to take the plunge and do it? And he
Right.
said,
Right.
I want some other people to get that
Yes.
first.
Exactly. Yeah. Let
That's
somebody else take those arrows in the back first and
it's your eyes.
come talk to me. Come talk to me once they figured out those issues as well.
Yeah.
Well, you know what? I could talk to you for another hour, but clearly, you and I committed to just do this in about 30, 35 minutes or
I
so.
know.
Yeah, and I
Feel
think
free
we
to cut
probably
here
gone
and
a
there.
little bit beyond that already. But I do want to give you the opportunity to share again, and a little bit more about what your company does. And if someone's interested in learning more about you and your role and what you do, and maybe have you as a thought leader or speaker, or if they want to get involved or engaged with leveraging your firm to support some of their efforts, tell us how they do that as well too.
So my particular firm is really focused on that healthcare design. And the design in itself comes full circle, right? When you're talking technology and health, smart spaces and different elements to it. So even there's architectures, engineers, there's lots of different people involved in healthcare design that we see on the back burner all the time that don't get nearly enough recognition, but they're not clinicians and they'll be the first to tell you that. So
Right.
our sweet spot tends to be the communication element and helping people have those conversations and have those difficult conversations. They know once they spend 5 minutes with me that they need that. But
Yes.
in truth, they don't know how to do it. How do we do
Mhm.
it? Because they get really overwhelmed. You can kind of see it in their eyes as they
Right.
get glassy eyed and everything like that. So that's our sweet spot. And my sweet spot is really talking to them and talking them through the process, helping them assess the situation.
Exactly.
One of the first things we learn as clinicians is to assess everything.
Mhm.
And you can't do a really good job without that thorough assessment. And it all starts there. So starting there is what I love doing. And just the sweet spot of translation. I love complex situations. Like I said, I have no problems talking to powerful people and helping them. I feel like I'm doing them a disservice if I'm not telling them the truth and the honest reality of the situation. And oftentimes, even my team at Introba, I will step back and say, okay, this is what they want to do. This is what it's going to look like at the end. We need to get them to understand this, helping them see that. And, and I'm also the person who's helping other members on my team, like, wrong audience, not now. So I know to take a minute and take a beat with my team and get everyone on the same page. And I think that's instrumental as well. But helping with that translation piece has become key. I know a lot of people say they're translators and that didn't work out really well for them, but I'm not that kind of translator. So I don't give up easy. Yes.
That's great. So if someone wanted to get in contact with you and engage you as a resource, what's the best way for them to reach out to you?
Email and LinkedIn. So by all means, I have an administrative day that's now went from Friday to Monday. But by all means, reach out to me on LinkedIn. I get lots of really good new connections, really great questions on LinkedIn.
Wonderful. And your email address?
MSN is my LinkedIn. And then acox at nautilussolutionsme.com.
Wonderful. Well, we're going to leave it there for now, Angie. I'm going to have you back and continue this conversation. So much more I want to talk to you about. But I want to thank you for your time. Thank you for your thought leadership. Thank you for your commitment to providing care for those who need it in the most critical times in their lives. Thank you for expressing your journey and sharing your faith journey through this process as well, too. I think that's also important for those of us who, walk that similar path as well, too. And to everyone that's listening as well, if this episode really resonated with you, and I know it did because it resonated with me, do me a favor, please share it with a colleague, a friend, classmate, and like I say, even someone you don't really care that much about, because we can all benefit from this woman's amazing journey, experience, and make us all better human beings because of it. So let's leave it there for now. And until next time, this is Christopher Cunny, and you've been listening to Straight Outta Health IT. Stay healthy, stay innovative, and please keep fighting for equality for healthcare for all. Peace and God bless.
Straight Outta Health IT, where the talk stay free. Tune in, turn up. This is where you want to be. Data-driven dreams, they decode the code. Hack the status quo, make the old ways implode. Gusts dropping gems like pockets of gold mines. Healthcare's front lines, redesigned in real time. Honey got the mic, architect of the chatter. Revolutions in the air, healthcare's new chapter. From telehealth to equity, nothing stays unseen. This is more than a podcast, it's the dream machine. The system's pulse is beating to the sound. Voices of change.